Hi everybody, welcome to another episode of Max Wellness. My name is Nurse Max, and here at Max Wellness, our aim is to help you maximize your wellness one video at a time. As we promised in our previous videos, we're going to talk about diabetes, what diabetes is, some of the complications associated with diabetes, some of the fruits or food that a diabetic can eat that will help normalize their blood sugar levels, and some of the food that a diabetic should abstain that will help them so that they'll always regulate their blood sugar levels. So it's going to be a series of episodes. So in this first episode, we're going to talk about what diabetic is and some of the complications associated with diabetes. So if you don't know, please watch this. So there are two main types of diabetes, type 1 and type 2. Type 1 diabetes is an autoimmune disease in which your body's own immune system attacks insulin producing cells in your pancreas. On the other hand, type 2 diabetes is a condition in which your body has problem or trouble regulating the sugar in your blood. Normally after eating, our body breaks down the food into sugar, which is later entered into the bloodstream. The hormone insulin helps move the sugar from the blood into the cells, which is later used as energy. So for those with type 2 diabetes, the body does not produce enough insulin, or the cells in the body become resistant to the insulin that is produced, so it's not effectively absorbed into the cells and then for the body to use. This means that the sugar stays in the blood instead of it being absorbed into the cells for the body to use as energy. This leads to a high blood sugar levels. Over time, high blood sugar levels is going to cause damage to certain organs and vessels, which we're later going to discuss or talk about. This is why it is important for diabetics to manage their blood sugar levels by the use of medication, dieting, and exercise. A good example that comes to mind when talking about type 2 diabetes is having a car with a broken gas pedal. Even though there's gas in the car wouldn't move unless the gas pedal is fixed, or the driver used a different method to make the car move, which is very difficult. Similarly, in type 2 diabetes, even though there is sugar in the blood, the body is not able to absorb the sugar into the cells for it to be used as energy. Remember that. So unless your body's insulin is managed properly, or other methods are used in managing your blood sugar levels, a type 2 diabetic will always have a high blood sugar level. Now, let's talk about some of the complications associated with uncontrolled diabetes. That is, the results of higher blood sugar levels on your vessels and your major organs. This is very important. Uncontrolled diabetes can lead to damage to almost all the major organs in the various parts of the body, which includes cardiovascular disease. Uncontrolled diabetes can increase a person's risk of heart disease and stroke. This is mainly due to the damage to the blood vessels and nerves that controls blood to the heart. The second complication that we're going to talk about is kidney disease. Uncontrolled diabetes can lead to damage to the kidneys, resulting in kidney failure, and this will require kidney transplant or dialysis on a regular basis. The third complication that we're going to talk about is nerve damage. Diabetes can lead to damage to the nerves in the body, leading to problems with sensation, resulting in numbness or tingling, or maybe a complete loss of sensation to that part of the body. Eye disease. Uncontrolled diabetes can damage the blood vessels in the eye, leading to complete blindness or vision problems. The fifth complication of diabetes that we're going to talk about is foot problems. So diabetes can lead to damage to the nerve or vessels in the foot, and this will result in foot ulcer, infection, or even a complete amputation. The sixth complication that we're going to talk about is skin conditions. People with diabetes are more prone to skin infections and skin disorders such as diabetic dermopathy, diabetic blisters, and Necrobiasis lipoidica diabeticorium. This is basically because most bacteria love sugar, and since your blood is sweet, they will love to feed on it. That's why you always get an infection, or a diabetic is always getting or prone to infection. Another complication that we're going to talk about is dental problems. Diabetes can increase your risk of getting gum disease, tooth decay, and other dental problems. The eighth and the final complication associated with diabetes that we're going to talk about today is depression and anxiety. This is very important. Living with diabetes can be very stressful and can lead to depression and anxiety. The anxiety is at its apex when your blood sugar is very low. Remember that. So I cannot stress how important it is for people with diabetes to manage their blood sugar levels with regular exercise, dieting, and medication. They also have to do a regular blood sugar checks, visit their healthcare provider or doctors on a regular basis to help prevent or minimize the complications associated with type 2 and type 1 diabetes, as we spoke about. So for those who don't know, the easiest way to check your blood sugar levels is to get a glucometer, and this is about $10 in Walgreens, Walmart, or any of your local pharmacies. With that, you can check your blood sugar levels on a regular basis and prevent it being too high or too low to avoid the complications associated with diabetes. Thank you. Thanks for watching another episode of Max Wellness. Please share, subscribe, and put us on post notification for more wellness videos like this. And oh yes, please, next week we bring in another episode on diabetes. This time around, some of the fruits that diabetic can eat that will help normalize their blood sugar levels. Thank you.